A 36-year-old woman gives birth at 34 weeks gestation to a male infant who lives for only 1 hour after delivery. On physical examination, the infant is at the 30th percentile for height and weight. Anomalies include microcephaly, a cleft lip and palate, scalp defects, and the findings shown polydactyly. Which of the following karyotypes is most likely to be present in this infant? A. 47XY plus trisomy 13. B. 46XY. C. 45X. D. 47XY plus trisomy 18.
Option A is the right answer.
Which painkiller is not given in vasculitis? A. Naproxen. B. Ergotamine. C. Acetaminophen. D. Ibuprofen.
Option B is the right answer.
A 55-year-old female presents with 4 months history of blurring of vision and itching on both the eyes. She also complains of dysphagia and dry mouth. On examination, she has bilateral parotid swelling and fibroid mouth fissures. Chest X-ray shows pneumonitis. The most likely diagnosis is A. Progressive scleroderma. B. Sjogren's syndrome. C. Polymyositis. D. Mikulicz syndrome.
Option B is the right answer.
When the hypothalamic temperature is set higher than the body temperature, then which of the following will decrease? A. Shivering. B. Vasoconstriction. C. Starvation. D. Sweating.
Option D is the right answer.
Which of the following have lowest pH? A. Gastric juice. B. Gallbladder secretion. C. Chyme. D. Pancreatic juice.
Option A is the right answer.
Raised BP with decreased heart rate is likely due to A. Hemorrhage. B. Raised ICP. C. High altitude. D. Exercise.
Option B is the right answer.
The drug contraindicated in chronic liver disease include A. Domperidone. B. Pentazocine. C. Hyoscine. D. Lorazepam.
Option B is the right answer.
A patient is administered a tuberculin. Which of the following types of hypersensitivity reaction is being tested, and which cells would be expected to mediate a positive test result? A. Type 1 hypersensitivity reaction, mast cells. B. Type 2 hypersensitivity reaction, cytotoxic T lymphocyte. C. Type 4 hypersensitivity T1 helper cell. D. Type 4 hypersensitivity reaction, T2 helper cell.
Option C is the right answer.
Which of the following shows complete ventricular depolarization on ECG? A. QRS complex. B. ST segment. C. PR interval. D. T wave.
Option A is the right answer.
Which is the most common cause of congenital cyanotic heart disease? A. VSD. B. ASD. C. TOF. D. AS.
Option C is the right answer.
A middle-aged lady complained of pain and tingling in her left hand radiating to the forearm. There was wasting of the thenar eminence and weakness of abduction and opposition of the thumb. Sensory loss over the palmar aspect of the thumb and index finger. The nerve likely involved is A. Ulnar nerve. B. Radial nerve. C. Median nerve. D. Lateral cutaneous.
Option C is the right answer.
A patient present with spontaneous lacrimation during eating. This could be due to misdirected regeneration of which of the following nerves? A. Facial nerve. B. Trigeminal nerve. C. Vagus nerve. D. Lacrimal nerve.
Option A is the right answer.
Nutmeg liver occurs in A. Periportal congestion. B. Alcoholic cirrhosis. C. Peripheral congestion. D. Chronic passive congestion.
Option D is the right answer.
A man with hypertension, hypernatremia, and hypokalemia presented with complaints of severe headache. ABGs reveal a pH of 7.5, HCO 332 milliequivalent L, serum cortisol and VMA with normal range. But serum aldosterone is increased and plasma renin is decreased. What is the cause of HTN? A. Conn syndrome. B. Cushing syndrome. C. Cushing disease. D. Addison disease.
Option A is the right answer.
Increased salivary secretion occurs through A. Somatostatin. B. Substance P. C. VIP. D. Prostaglandin.
Option C is the right answer.
A hospital infection with which of the following organism requires fumigation in the patient room? A. TB. B. H1N1 influenza. C. MRSA. D. VRE.
Option B is the right answer.
The most characteristic signs and symptoms of Clostridium botulinum is A. Dysentery. B. Diarrhea and vomiting. C. Fever. D. Flaccid paralysis of respiratory muscle.
Option D is the right answer.
Half-life of cimetidine is A. 10 minutes. B. 5 minutes. C. 60 minutes. D. 120 minutes.
Option D is the right answer.
Premature labor with premature rupture of fetal membrane occurs at 20 weeks of gestation in a 20-year-old woman. Prior to that time, the pregnancy has been proceeding. A stillbirth occurs 2 days later. Microscopy examination of the normal-sized placenta reveals numerous neutrophils in the amnion and chorion, but no villi. These events are most likely to be mediated by the effects from release of which of the following substance? A. Complement. B. Fibrinogen. C. Prostaglandin. D. Lymphokinase.
Option C is the right answer.
A young female of 25 years of age reported to a physician because of weakness and fatigue of skeletal muscles, especially extraocular and facial muscles. She was diagnosed a case of myasthenia gravis. The type of antibodies acting against acetylcholine receptor is A. IgA. B. IgM. C. IgG. D. Ig.
Option C is the right answer.
A young patient presented in OPD after having operation 1 week back. He complains about pussy wound discharge from the site of operation. On microscopy, gram-positive cocci was found. Initial drug in this patient will be A. Penicillin. B. Ceftriaxone. C. Azithromycin. D. Vancomycin.
Option A is the right answer.
Effective insulin is due to suppression of A. Glycogenolysis in liver. B. Gluconeogenesis in liver. C. Protein storage in muscles. D. Glycogen storage in muscles.
Option B is the right answer.
After RTA, patient presents to OPD with difficulty in understanding written and spoken language. This is due to damage to A. Parietal lobe. B. Wernicke-S area. C. Frontal lobe. D. Broca area.
Option B is the right answer.
A girl spilled hot water over her hand, develops clear fluid bully. Few hours later, she developed fever, bully erythema, and warm with opaque fluid. Type of inflammation is A. Fibrinous. B. Serous. C. Catarrhal. D. Purulent.
Option D is the right answer.
Clara cells are present in A. Larynx. B. Trachea. C. Bronchi. D. Terminal bronchiole.
Option D is the right answer.
Thank you for watching. If you enjoyed this content, please consider like, subscribe, and sharing it with your friends. Your support means a lot to us.